guys, this is Dr. Patel with Harmony Oral and Facial Surgery, a board-certified oral and maxillofacial surgeon. Welcome back to my channel. Today I have a very special guest with me, Meet Hannah. She is my office manager, and we are going to talk about some important things that, things you'll have questions about when you come here for consultation. So we understand at Harmony that oral surgery procedures could be daunting sometimes financially, and we want to make sure that you know your options and that your dream smile or whatever it is that you're trying to achieve does not have to be out of the reach, and it's still very affordable. So Hannah, what are some of the options that we can consider financially to make these procedures more affordable?
So I think it's important for patients to know that it's completely achievable. It's a very quick process. It takes maybe a few minutes or so. We come in, we gather basic information, we run it through a tablet system, we get this instant approval, and we get an authorization number, an approval, a dollar amount, and we can pretty much start scheduling for treatment. That's how quick and simplistic this process is.
Okay. All right. So what kind of information do you need from patients in order to get this going?
So for the most part, it's basic information, demographic, background, income. The great thing about this is that incomes can vary, credit scores can vary, which is great. We do have options for all types of credit scores, different tiers, different levels. And once again, like I said, the approvals are in sync, so we know exactly what we're working with, and we can just go ahead and schedule and make it a really smooth, easy process.
Yeah, and what kind of monthly payments can they expect with financing?
Honestly, as low as $100 a month. There are many different options. The way this pretty much goes is we input the dollar amount and it generates many different options. The beauty of this all is that it's completely up to you guys, the patients, to decipher what works best for you. Whether it's a 16-month ordeal, whether it's 72 months, whether it's 12 months, whatever works best for the patient. It's completely in your hands.
So walk me through what are some of the options that they can, lean on to finance their procedure?
So there are many different vendors that we work with. We're not contracted with anyone specifically. We just offer a variety of many different options that we work with. Vendors who work with patients who have lower income, better credit scores, patients who want to finance larger amounts of money. So it gives you that flexibility to do both. Some of these companies pretty much range from Cherry to Proceed Financials to Care Credit to Sunbid and some others as well. In addition to these options, we of course accept all forms of payments with patients. Whatever works best that we can help transition the patient to treatment is pretty much our goal.
Okay, I think that's extremely helpful. Can you also tell us about other options outside of financing companies? Some outside the box options that people don't usually think about?
So a lot of patients are actually not aware that you do have options if you do own homes and have home equity loans and things of that sort, to really dabble into that and speak with your financial institution and see what can be done. A lot of patients feel more comfortable going down that route versus getting into other financial agreements, but it's really ultimately up to the patient and what works best and what they're most comfortable with.
Another option would be HSA or FSA money.
Absolutely.
Right?
So the way HSA and FSA works, it's your money. It's money that you set aside with your job that can be allocated towards any type of medical treatment, which is great because you get, I believe there's a tax credit there as well, and you could really utilize it for any form of medical or dental procedure that's needed.
Yeah, I think those are great options. Another option that some people don't necessarily think about would be drawing on your 401k.
Absolutely.
For lower interest rate. Sometimes the interest rate is super low in comparison to other options.
I've heard of that as well. A lot of patients have the option to dabble into their IRA accounts, as they're called, where they have the option of pretty much taking an extended loan where they're pulling out funds from their current account where they have that funds available. And I know they pay a very minimal amount for a fee, and you can withdraw that whole account, that whole amount, and that goes directly to the practice. And then you pretty much replenish that back with your financial institution at that point.
Yeah. All right. So far we talked about pulling on your credit and looking into financial companies that'll lend you money for healthcare, essentially. Looking into HSA, FSA, and 401k. There's always options with credit card, and your insurance company can weigh in a little bit too. So I think that sums it up.
Absolutely,
right?
Absolutely.
So your health is ultimately your decision and your financial decision, and your quality of life is, of course, something that matters more in your current stage. So, now that you know your options, you are well informed on how to achieve your dream smile and how to go about financing for your oral surgery procedure.
Absolutely. If you have any other questions or concerns, please feel free to give us a call. We're here to answer any questions and we could be of any help if we can. Just give us a call and we'll be more than happy to assist you.
All right, well, that's a wrap. Thank you so much for joining us today. If you like the content, please follow us and our channel on YouTube and other social media. Bye-bye.